to find anyone whose mental health hasn't been affected by the events of the last year. Changes to the way we live and work, job losses, businesses closing, a relentless flow of bad news. It's been pretty tough for us all. Well, now, new collaboration between businesses, including some of the biggest in the world, like HSBC, Unilever and the mining giant BHP, are working together to support mental health in the workplace. Well, that's called the Global Business Collaboration for Better Workplace Mental Health. And I can discuss it now with Sharon Thorne. She's the Global Chair of Deloitte. Sharon, very good morning to you. What was the genesis of this collaboration?
Good morning. To your point, there have been an enormous number of challenges during this year that I suppose have exacerbated what we were already seeing as a significant crisis in mental health, with, for example, businesses losing about $1 trillion a year due to employees suffering from mental health issues. And Deloitte has done a survey of millennials and Gen Z, and they said that 44% of millennials, 48% of Gen Z said that the biggest issue they were facing is anxiety and stress. And so, it's something that Deloitte believes very passionately that we have to address. We want people's mental health to be taken, as the same priority as their physical health. We've been working with a number of people, including the City Mental Health Alliance, for a number of years, and businesses like HSBC to share best practice. And we felt it was the right time to come together and create a platform for us, for experts, for practitioners to come together and share best practice and really, I suppose, drive forward, taking this across the world. I think there's a challenge that there's a stigma around mental health. I think CEOs and leaders leading from the front on this is critical. And the platform where we've asked everyone who joins the collaboration to sign a pledge with 6 commitments, which are all about improving workplace practices around mental health and empowering employees to take more control and responsibility for their sort of mental health.
Sharon, I'm really intrigued by the research that you just mentioned there, the fact that millennial and Gen Z workers finding it tougher in terms of their mental health. I mean, you and I think we're cynical old Gen Xers. Why has it not affected older workers as much?
It is affecting older workers significantly, and we are seeing isolation is affecting everyone, and also the challenges of homeschooling, as you know, and all of the things that are being the additional responsibilities people have. But there's quite a lot of young people are living on their own, so isolation is a real issue, and there are more pressures on young people today, I think, than the pressures we had, partly created by things like social media, but also there's more unemployment, or they're looking out at the moment post-COVID and thinking, will I have a job? So there are some real challenges. And, another, I suppose, just interestingly, half of the 18,000 people we surveyed said that, this anxiety and stress was their first or second priority because it was just overwhelming for them. And the other issue is, they're talking about the fact they find it very difficult disclosing any mental health issues at work. And so it is really important that employers try and provide more solutions to people to enable them to open up and share their experiences, and so to enable us to give them the support and help that they need.
That's a really good point you've made there. I mean, traditionally, mental health has had a bit of a stigma in the workplace, particularly in rough and tough workplace environments like here in the city, for example. Do you think the pandemic is going to change that?
I think that's one of the positives that we can see coming from the pandemic, Ian, that people are opening up a lot more. People are recognizing that it's such an issue, and people are now taking action. And we at Deloitte have put in place a sort of a baseline around the whole world in terms of expectations of our leaders and the things that we should be doing. We have regular check-ins with people. We're teaching people, our leaders, when you ask someone, are you okay? They often say, yes, I'm fine. But follow it up with, are you really okay? And then giving them some tools and things that they can help people with. We're doing lots of virtual online things to bring people together. In the UK, we've set up something called a coffee club, and anyone can email in each week and say, I'd like to be part of the coffee club. They're matched with someone, and then they can have a Zoom call and just have new connections. And we've seen some great relationships building from that. But there's lots of things companies can do But I think this sharing of best practice is really important. But also one of the other really great things that this collaboration is doing, the Wellcome Trust, for example, have committed £200 million of funding into studies so that you've got more evidence about what will work. And just one great example from a study they've already done, they said, we're all sitting a lot more in this current environment, and sitting for 8 hours a day is obviously not great, but if you could have just 1 hour of activity, it significantly reduces stress and anxiety. So there are some real tangible things that we can help people with.
Very good point, that. And more broadly, Sharon, how is the wider Deloitte group doing right now? I mean, anecdotally, I hear that business services groups are having a pretty good time of things right now.
So there are, parts of our business that have been doing very well in the current environment, helping our clients, supporting our clients who are going through, the need to transform. So, digital transformation is something that's very important, technology transformation, and we're here obviously to help our clients go on their journeys. But also, as I say, critically, our focus has been to support our people.
All right, Sharon Thorne, very good to talk to you. Thanks for joining me.